Today, we will discuss spinal cord injuries. But really quickly, are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Spinal cord injury, SCI, refers to damage to the spinal cord, which is the bundle of nerves that runs down your back and carries messages between your brain and the rest of your body. In simple terms, it means that something has hurt the spinal cord, which can disrupt these messages and lead to problems with movement, sensation, or other bodily functions. Signs you might have a spinal cord injury. 1. Weakness or paralysis, difficulty moving your arms or legs or feeling weak in one part of your body. 2. Numbness or tingling, strange sensations or loss of feeling in your limbs. 3. Loss of bladder or bowel control, trouble controlling when you go to the bathroom. Pain, severe pain in your neck or back. 5. Difficulty breathing, problems with breathing, especially if the injury is high on the spinal cord. 6. Changes in reflexes, exaggerated or diminished reflexes when you touch certain areas of your body. If you suspect you have a spinal cord injury, it's crucial to seek medical attention immediately. Early diagnosis and treatment can significantly affect recovery and outcomes. If you think someone has a spinal cord injury, here's what to do. 1. Stay calm. Keep yourself and the injured person calm. 2. Do not move them. Avoid moving the person unless there is immediate danger, like fire. Movement can make the injury worse. 3. Call for help. Dial emergency services like 911 to get professional medical assistance. 4. Keep them still. Encourage the person to stay still and not to try to get up or move. 5. Support their head and neck. If possible, support their head and neck to keep them stable. 6. Monitor breathing. Check if they are breathing normally. If not, be prepared to perform CPR if you know how. 7. Stay with them. Keep talking to the person and reassure them that help is on the way. Remember, the priority is to get professional help as soon as possible. In the hospital, doctors and nurses take several steps to help someone with a spinal cord injury. 1. Assessment. They check the person's condition, looking for signs of injury and assessing how serious it is. 2. Imaging tests. They might use X-rays or MRIs to see the injury clearly. 3. Stabilization. They keep the spine stable using a special collar or a backboard to prevent further damage. 4. Medication. They may give medicines to reduce swelling, relieve pain, or help with muscle control. 5. Surgery. If necessary, doctors might perform surgery to fix any damage, like removing bone fragments or stabilizing the spine. 6. Rehabilitation. After initial treatment, they will start rehabilitation to help the person regain strength and learn new ways to manage daily activities. 7. Supportive care. Nurses and therapists provide support for breathing, bladder and bowel function, and physical therapy to improve movement. Overall, the goal is to minimize damage, promote healing, and help the person adapt to any changes in their abilities. Here are some commonly used medications for spinal cord injury. 1. Methylprednisolone, Medrol, a corticosteroid used to reduce inflammation and swelling around the spinal cord shortly after the injury. 2. Pain relievers. Acetaminophen, Tylenol, for mild to moderate pain relief. Non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, Advil, or naproxen, Aleve, for pain and inflammation. 3. Muscle relaxants. Baclofen helps reduce muscle spasms and stiffness. Cyclobenzaprine, another option for muscle relaxation. Antidepressants. Amitriptyline, sometimes used for pain management and emotional support. Anticonvulsants. Gabapentin, often prescribed for nerve pain. 6. Bladder medications. Oxybutynin or tolterodine, help manage bladder control issues. These medications may vary based on individual needs and the specifics of the injury, so it's important for treatment to be guided by medical professionals. People at an increased risk of developing a spinal cord injury include 1. Athletes, especially those in contact sports like football, rugby, or wrestling, where falls or collisions are common. 2 motorcyclists. Riders who don't use helmets or protective gear are more vulnerable in accidents. 3 people in accidents. Those involved in car crashes, falls from heights, or diving accidents. 4 older adults. They're more likely to fall and suffer serious injuries due to weaker bones and balance issues. 5. Individuals with certain health conditions. Conditions like osteoporosis, which weakens bones, can increase the risk of fractures and injuries. 6. Military personnel. Those in combat or training situations may face higher risks of injury. 7. Substance users. People under the influence of drugs or alcohol may have impaired judgment and coordination, leading to accidents. These groups should be especially cautious to help prevent injuries. Now you need to watch my video on hyponatremia or have a look at otitis media.